Hello, I'm Dr. Emanual, and I am honored to be your president of the Medical Society of the District of Columbia. For over 20 years, I've worked for the Mid Atlantic Permanente Group. I am boarded in the field of obstetrics and gynecology. My goal as your president is to ease the practice of medicine as we maneuver through this pandemic over the next 12 months. What do you need? What do you need when COVID 19 has a crushing effect on your medical practice? When you are experiencing a substantial decrease in revenue, a substantial decrease in volume, when you are forced to lay off, or you're furloughed by your employer. Despite the disappearance of revenue, we continue to go to work every day. We continue to see our patients. We continue to expose ourselves to risk. Because much is to be learned about this novel virus. There's no vaccine. Care is primarily supportive rather than curative. You need a multi-pronged effort. Effort designed to protect you and your patients. MSDC has that information and more. We can help you maintain access, provide protocols for treating your patients, better manage your staff, and to limit your exposure. We have tips on using telehealth services to screen and care for your patients, and tips for using remote monitoring. You could get affordable PPE delivered to your door through MSDC's collective buying program. You need an organization that's fighting for you and for your patients. So what do you do? What do you do when the regulations stand in your way? When 60% of primary care physicians' work isn't reimbursed or funded, and the majority of that work is telehealth. When only 30% of your services are eligible for Medicare reimbursements. What do you do when the recommendation from the CDC do not align with the recommendation or the actions of Congress and the administration? The Medical Society is fighting every day to remove these obstacles while we confront the COVID 19 pandemic. We're advocating tirelessly for City Council and the Mayor's office to support medical and group practices during this public health emergency. We have sent or signed on to letters urging them to immediately address issues surrounding payment, bolster medical health services, and to address disparities affecting racial, ethnic, and marginalized communities affected by this pandemic. That's just to name a few. We're going through an immediate and dramatic public health crisis that requires an immediate and dramatic action. The Medical Society is listening to physicians and will continue to channel your collective voice into action. So, how do you feel? How do you feel when just a few months ago, the country clapped for us? When they wrote hopeful words on hospital walls and sidewalks for us? As COVID 19 cases and hospitalization rise, as we await an effective vaccine, the personal risk we face make an already demanding job even harder. How do you feel when the toll of caring for your patients with a deadly virus has left many of you with a real risk of ongoing depression or even post-traumatic stress disorder? Even before the corona outbreak, many healthcare workers already faced burnout, stress. Now this crisis is presenting clinicians with a greater workplace hardship and moral dilemmas that are very likely to exacerbate existing levels of burnout and related mental health problems. Through the amazing work of Dr. Pineda and Robert, the Society has bolstered the mental health infrastructure needed to support our doctors who are working tirelessly to save patients' lives. The Medical Society's Physician Wellbeing Program is just a click away. We are still applauding you. We are still here for you. It will be better. I feel your pain. I know what you're going through. I know that it can be frustrating. I know that it can be daunting. I know that it can be overwhelming. But you cannot give up. You need the medical society to continue this journey with you. You need the medical society to provide valuable information that addresses patient access, protocols for patient engagement, and telehealth and remote services, to provide information to help reduce financial losses, and a program that addresses your mental well-being. Look, we're in this together. So get involved. Continue to belong to the society and encourage others to join. There's strength in numbers. Participate actively and stay engaged. How can you stay engaged? Go to our website. We have a robust and comprehensive website, and we're regularly adding information. We're also open to suggestions. Provide your feedback on issues and legislation so that we can advocate for you. Share your collective voices. Call us, email us, join a physician networking group like Bright Young Doctors, Women in Medicine, Practice Management. But by whatever means, stay involved. In conclusion, as we navigate through this unprecedented time, as our colleagues are struggling to maintain a practice, as we struggle to maintain patient care, we must continue to remain united to ensure that our voices are heard. As I stated earlier, my goal is to ease the practice of medicine in the District of Columbia. We do not sleep when we are tired. We sleep when we are done. Thank you.